We're now going to be comparing atherosclerotic peripheral artery disease with other types of arterial problems that can happen in your periphery to be able to get differential diagnosis on some of these. So first of all, you need to understand that atherosclerotic peripheral artery disease is from an atherosclerotic plaque that is obstructing the blood flow going into your limbs. These other ones are not caused by an atherosclerotic plaque. They're caused by something else. Let's go through them. First of all, we have arterial entrapment. So somebody comes in, you have arterial entrapment. It can be thoracic outlet or it can be popliteal. Thoracic outlet syndrome, popliteal syndrome. Thoracic outlet syndrome is basically just that. You have the thoracic outlet, and you have right there the subclavian artery and the brachial plexus are sometimes compressed. And what you can do is you can test the person, during exercise. And then the treatment of this is you might have to remove some of their cervical ribs. Popliteal, this is where this blood vessel is trapped by the gastrocnemius or the popliteus muscle. And the treatment for that one is going to be surgery if it's symptomatic or greater than 3 centimeters. Next we have sorry, I'm getting over being sick. An arteriovenous fistula. Basically what this is, you see arterio and you see venous, so you see an artery and you have a vein, and there's a fistula or a connection between the two that's bypassing the capillaries. And so in that case, you listen over, you're going to hear a thriller or a bruit because you have blood going from a really high pressure system going to a really low pressure system. So the blood's going to fly in there really fast because it's not obstructed by going through these really small capillaries in order to get over there. And sometimes, I guess there's also, with this, the compression of the feeding artery, it might equal collapse of the fistula. But you might have to do some surgery or something like that in this case. Next is Raynauds phenomenon. Raynauds phenomenon is basically when the blood vessels in your hand contract, and they get cold, but they don't warm up. So you'll see these people having these really white, discolored fingers. When the blood returns to it, it gets really red. What you can do is do things that are going to prevent the vasospasm or stop the vasospasm. Calcium inhibiting drugs or nitrates would do this. Would treat it. Other ischemic syndromes are going to be things like enosis. This is more typically occurs in young women. It's persistent cyanosis of the hands due to cold exposure, but the pulses are normal and there's no ischemia. You can also get Ligato reticularis, which is a lacy pattern skin mottling due to local spasm of dermal arteries. So in your skin, the arteries in there, spasm down. And if you want to fix it, you can just keep the person warm, and that'll avoid problems. Also, the person can get pernio, which is a more vasculitic picture on skin biopsy. And it involves the lower legs and the feet more oftenly. It's associated with cold as well. And so what you can do is you can keep the person warm, and maybe some calcium antagonists might help as well to stop that vasospasm. Next is erythromalacia. This is erythema of the extremities, feet, associated with burning pain and with exposure to warm temperature. More often happen in people in their 50s, and more often it's men. And you can give the person some aspirin, and that will help some. You think erythro means blood, or blood cells, and so aspirin helping the blood cells can help you think, I don't know. Next also is frostbite is another one. You guys know what frostbite is. It's direct tissue freezing and vasoconstriction. Get the person a rewarming bath in 104 to 111 degrees Fahrenheit water, suitable analgesic with sterile dressing and surgical consultation on antibiotics and debridement. And that is it.